This is Encrypted Ambition, a podcast about the builders rewriting the rules. Join Petronella Technology Group as we decode the ideas, challenges, and momentum behind tomorrow's business, technology, and leadership breakthroughs.
One second. Welcome to another episode here of Cybersecurity with the Petronella Technology Group. I am, of course, Blake Ray here. I am actually sitting down with Scott. Scott works at a small regional hospital, the Southern Coos Hospital, and interesting conversation we are going to have here about AI, being in a rural hospital setting, making use of the frugal budget that I'm assuming your hospital has, and how to stretch every dollar in healthcare. Welcome to the episode.
Well, thank you, Blake. I really appreciate the opportunity to speak with you today.
Yeah. Tell us about, Southern Coos. Tell us how you got to where you are, and tell us a little bit about yourself as well.
Perfect. Well, I'll start with myself and then lead into some of the initiatives at Southern Coos. I have been in healthcare only for about the last 10 years of my career. I grew up in fundraising and marketing, actually, and then took a turn to the IT world, somewhat by necessity. I was working at Southern Coos as the primary fundraiser and marketer, and demonstrated some facility with project management. Started helping out the IT department and the admin staff with some projects, and then moved over to the chief information officer role about 8 years ago. And so I have loved it every minute. There have been many challenges that I'm sure we'll get into, but it was a great move for me and for my career, but also just learning the ins and outs of healthcare, IT, and then healthcare in general has been just really enlightening for me personally and professionally. Southern Coos Hospital and Health Center is a small critical access hospital. We're down here on the southern Oregon coast. We are licensed for 25 beds, and our census has been growing dramatically over the last few years. We recently went live with Epic Community Connect, and that's hosted by Providence Health Systems. So Providence is our host for the Epic instance, and we just went live with them on December 7th. So in a certain regard, we are still in a post-live optimization environment. So a lot of work to do, optimizing the workflows, particularly around the clinical workflows. We've got a lot of those locked in, but a lot that needs to be remediated. Let's see, Southern Coos Hospital, we've got a full service ED, 24/7 ED. We've got primary care, which is growing, and just hired a couple of family nurse practitioners. We've got 2 MDs on staff. We just hired a gynecological surgeon, and we're in talks with the dermatology group, also with a general surgeon. So over the last about year, we've really kind of hit our stride in growth, trying to serve a very rural population. And just to give you kind of a quick idea of what our population looks like, we are the town of Bandon, Oregon, is where Southern Coos Hospital is. We do have about 3,200 people in the town of Bandon. However, our catchment area is more along the lines of about 15,000 people up and down the southern Oregon coast. We are lucky to have the Bandon Dunes Golf Resort right in our backyard. It's a world-class facility. And in fact, Southern Coos Hospital is providing medical services for the 125th USGA amateur tournament, which happens in August. So are developing a lot of partnership opportunities with Bandon Dunes and other businesses around Bandon and the southern coast.
Yeah, I was doing some research before. I mean, it's beautiful there.
Yeah, it really is.
I mean, just it's so scenic.
Yes.
And it's also particularly amazing because, I mean, you guys got the best of both worlds. I mean, you've got the state parks. I mean, you've got tons of recreational sites. I mean, type of natural preserves.
Yep.
I mean, the coastline of Oregon. I mean,
Yes.
need I say more? It's
Right.
stunning. So,
I'm really glad you brought that up, Blake, because we get a lot of people here for natural resource tourism and recreational tourism. In addition to the things you mentioned, we've got a significant network of biking trails and also hiking trails. A lot of people come out here to windsurf. People come out to fish. People, will bring their motorhomes in or their, bring their tents and kind of camp for, a month or two during the summer. It's a great place for recreational tourism.
yeah, you guys are about 4 hours away from Portland. Is that right?
Yeah, about 4.5, depending on how fast you drive, and what time of day it is. But yeah, it's about 4.5, and we're south, so we're out here right on the edge of right in the edge of the continent, so to speak, and we're very geographically isolated, which brings a lot of challenges, which I'm sure we'll get into. But yeah, that's we have a lot of our patients will go to other locations for specialty care. And in sometimes primary care, depending on when they can get an appointment. So.
What has been kind of like the strategy that Southern Coos has tried to deploy in terms of service offering? I mean,
Mhm.
patient care. Like, I'm sure you guys have a unique strategy considering
Mhm.
you said you have 25 beds
Yeah.
in a town of about 3,200.
Mhm.
What has been some of the priorities that you guys have focused on?
Yeah, it's a great question. So what we've done, Blake, is we've done several studies on what we believe our community will need from a healthcare perspective. So one of the reports that we do is mandated by federal law. It's the Community Health Needs Assessment. Now that's done about every 3 years as required, and so ours is a couple of years out of date. So we'll do another one next year. In the meantime, we feel like 3 years isn't quite enough to get a handle on kind of what our demographics are showing in terms of where they're seeking healthcare, what what kinds of services they need, and then for us to make an analysis on what we can do in-house as a small hospital, and then what we can do to strengthen the communication with what we call tertiary medical facilities, those facilities that are, maybe in a Roseburg, Oregon, or a Eugene, Oregon, or even in Portland, Oregon, those where that we can strengthen the communication between Southern Coos Hospital and those other organizations to ease the transition, or ease the experience of our patients going to those other facilities for care. So so what we've done is really focusing on the service lines that we believe that we can implement fairly quickly at a reasonable cost for us, and also that will have the greatest impact on our patients. So, for instance, I mentioned dermatology. You might not think that dermatology would be a big issue, but we have a very elderly population. We also have a population generally that doesn't use a lot of sunscreen. Which is odd,
Yeah.
because the Southern Oregon coast is cloudy about 9 months out of the year, and so people don't think that they need to, but they do, and so we get a lot of skin cancers and things like that. So dermatology is one specific service line that we're developing. General surgery is another. Again, we have a lot of folks who need biopsies and need colonoscopies and endoscopies, and just as kind of maintenance and preventative care. We also are looking at an orthopedic surgeon because, again, our population trends elderly. A lot of folks are, wanting to have a knee replacement or a hip replacement. We want to be able to provide those services here.
Yeah, so that's kind of cool. I mean, it seems like you guys are taking a community first approach to healthcare, just kind of like doing consensus, seeing what the needs are of the community, and then building your hospital system around it, which is kind of a cool approach.
That's absolutely right, and it's an approach that is really brokered by necessity. We feel that we can't as a small community, and I should say that we are community owned, meaning that we're not owned by a larger system. We are part of a health district, and it's a taxable district, and so we feel beholden and responsible to our community, which really motivates us to get as much community input about our current and future direction as possible.
Yeah, I mean that's an amazing approach. I'm curious, and this is probably something that a lot of our questioners are asked. I mean, I've worked and we've talked with a lot of the bigger health systems, upstate New York, I mean, New York City, I mean, Los Angeles County. I mean, you can imagine the amount of funding that goes into those healthcare systems. Curious to get, curious to get your take on how funds are appropriated to smaller healthcare systems and how they're prioritized and what type of challenges you guys have being a rural provider and how you're addressing them.
Yeah, it's a great question. So, not to get too much in the weeds, but we are, as a critical access hospital, that's a federal designation. So, as a critical access hospital, we are eligible for a different higher level of reimbursement than perhaps other hospitals are. And so what that means is that a lot of our expenses are reimbursed at a little bit of a higher rate. It was created in the critical access designation was created in the 90s in order to preserve rural healthcare facilities. Between 85 and 96 or so, hundreds of hospitals were closing. So Congress acted to create this designation as essentially to preserve the safety net. And so we, again, feel very responsible for the utilization of the funds and the revenue that we bring in. We also get taxable income or tax income from our constituents. So between those two, between actually three revenue streams, the reimbursement and then our regular fee for service and then also our tax income, we are very careful about what we spend our money on, basically. And so we've always got to keep our eyes on, the bottom line, month on month, but then also year on year and kind of trying to make those strategic decisions and strategic investments that will bear fruit for us, 1 to 5 years down the road. So that has been a challenge for us to kind of shift our thinking, particularly from the governance level and from our board of directors. We have a great board of directors. They're publicly elected, which is wonderful. However, there's no mandate that they have healthcare experience. So anyone can, and by design, anyone can apply for as a candidate and then be elected, and that's great because we want a wide variety of experience. There is a higher educational curve for new incoming board members just to kind of wrap their minds around the complexity of healthcare generally, but then also rural healthcare. And so, when we propose even, small multi-million-dollar projects, that takes a lot of I guess presentation and evaluation, just understanding all the vendors that are involved. I mentioned earlier that we had just gone live with Epic in December. That was the culmination of about a 2-year project where we spent about a year evaluating, going through all the vendors. We came up with a total cost of ownership for the entire project, and we had a lot of negotiation with our board. They wanted to be sure, and they wanted to be absolutely positive that this was the right path for us to go in, because if we had failed, that would have crippled our hospital. So, every other rural hospital in America is going through the same evaluation in various forms. And so that bears a lot of risk. So we have to be absolutely sure that we have the right resources in place to make these projects successful.
I'm assuming the age-old adage of carpentry, which is measure twice, cut once, in your case is truly that.
It's measure like 12 times. Yeah. And the thing is, Blake, is that as we go through these evaluations, we think certain external environmental factors change, right? While we're making those evaluation decisions, and we might make a decision at the beginning of the process that 6-8 months into the process we have to reevaluate because of some sort of external environmental change that we didn't have anything to do with. And what I'm thinking of specifically are labor costs, right? Or material costs, those kinds of things.
Yeah, I mean, and obviously, since you guys are super rural, I mean, the mandates don't change. Like you still have patients, you still have patient
Exactly.
data. I mean, you still have to protect their data. HIPAA
Yes.
doesn't change depending on your size.
Yeah, exactly. Yeah.
And so I'm curious about, what are some of the compliance challenges that face rural hospitals similar to yours?
Well, I mean, you kind of you forecasted this really well, Blake, in terms of the making sure that data is getting into the system with a certain amount of accuracy, and then on the other side, making sure that we have the ability to pull that data into a reporting form that then we can then report out to our regulatory agencies. Really ever since COVID, the regulatory burden has become pretty intense, and there are lots of regulatory mandates now that weren't in place before COVID, and we feel very strongly we need to be compliant, and every other hospital does too. We have a quality department that we've been building up. That's been a strategy internally for us. We started off with a single quality director, and now we have a team of 4, and 2 of those are data analysts. And so we're doing the same thing in clinical informatics, where we started off with no clinical informatics department a few years ago, and then when I came in, I identified that as a need. So we've been slowly building up that department, and really shifting from I guess I would call it a break-fix model, both in quality and IS in clinical informatics, to a more kind of proactive data analytics model, where we have the staff to reset passwords and to replace printers and things like that. But the higher value, I guess, in a certain regard, a higher value uh, uh, job description, I guess, is to really dig into the more active data mining. And so we're really doing that. We're creating a kind of a cross-departmental team between all those folks that I talked about, clinical informatics, IS, and quality, to really kind of formalize our reporting to regulatory agencies. We also have internal reporting that we'd like to do, particularly around provider performance, wanting to make sure that our providers are providing as the best quality service to our patients as possible. So it's been a real journey for us, as I know it has been for a lot. As those regulatory burdens increase, we have luckily, and with some strategy, made that decision to increase staff and competencies around data analytics.
I'm glad that you also kind of brought up COVID. Obviously COVID was a huge kind of test and
It really
benchmark
was.
measurement for most of the hospitals that we've talked to and healthcare service providers.
Yep.
How did that kind of affect your network, your hospital network? And I'm assuming, with 25 beds, I mean, it was probably a little bit more overwhelming than anything.
Yeah.
And how have you kind of learned from that experience, into now serving it and providing more overarching services and being able to take on a little bit more of some type of virus or illness,
Yeah.
Pla-
Yeah. No, that's a really good question, Blake, and I'll approach it in a number of different ways. So the first is from the patient. So from a patient perspective, it was actually really interesting. Is that we actually saw a decrease in our inpatient census, and also our primary care visitation. And we think that the reason is that because we're remote, because there are transportation. A lot of our patients have transportation challenges. They either don't drive or they can't drive any longer. Um, People weren't able to get here. Also, there was a general sense here in our community, and I can't really speak for a lot of other communities, although I've heard I have heard and read other articles about how other communities had this phenomenon as well. You might pin this as a point of research, is that a lot of people in rural communities felt like they just wanted to shelter in place and they put off a lot of their medical needs. And so that was very instructive for us, just in terms of, kind of developing not only communication strategies to our patients, but also perhaps, preparing, I guess a more robust transportation strategy in the case of a future pandemic. So we have been working with our local ambulance company and other, medical transport companies to kind of, develop a strategy just in case, right? So then, from you mentioned a networking point of view, before COVID, there was a real sense that we were kind of out here on our own, and that we were siloed, geographically isolated. We didn't really have a lot of connection with, the state health authority or the hospital association, let alone with other critical access hospitals and rural facilities. During COVID, there were, as you probably remember, there were like, you know, millions and millions of meetings happening, just by virtue of us all being isolated, but then also because everybody was trying to figure out what was going on, particularly early on. And so I can just remember, being on meetings and meeting after meeting, basically daily or bi-daily meetings where, with the state, just trying to figure out like, why is this money coming to our bank account, or
Yeah.
where is the PPE, or like you know what PPE is. I don't need to explain that to you, but I mean,
Yeah.
it's it was daily, and that has really continued after the pandemic. We have a much closer relationship not only with our state health authority and the hospital association, but also with the state government. We also have really brokered a deep relationship with our reps, our local representatives, and so that it was really a takeaway for us to make sure that we had those connections.
Yeah, no, I mean it I'm sure, yeah, it's changed a lot of things in healthcare.
Yeah,
I'm serious if let's spin it back a little,
sure.
and talk about maybe some of the cybersecurity threats that you
Hmm.
feel like are particularly affected, more in a rural setting. Because obviously, like you guys don't have the same type of budget for cybersecurity and IT that some of the other people
Yeah,
we've talked
yeah,
to. What do
yeah.
you feel are particularly challenging threats to overcome, for cybersecurity and compliance,
Well,
especially being in a rural setting?
you hit the nail on the head. I mean, it's about budget, and it's about making a conscious decision to invest in cybersecurity, just like any other project. And that's what we've done, is try to spin it less as a. I think there's a kind of a lot of people have kind of an antiquated notion about cybersecurity as being sort of like a nice to have and not a must have. And
Right.
so we really have kind of pitched it as a must have for the success and for the sustainability of the organization. And so we treat it as a project. And we've increased our cyber spend from about 2% of our IS budget to just over 12% over the last 4 years. And the reason for that is that we were subject to a ransomware attack. And that was right before COVID hit. So we had this, interestingly enough, Southern Coos had this series of really unfortunate events in early 2020, which was our CEO was let go right before COVID. We had a major ransomware attack, and then COVID. So there was it was really hard first quarter of 2020 for us.
Yeah.
Not that it wasn't hard for everybody else either, but
Sure.
at any rate, so we were subject to a ransomware attack, which then really instigated the investment into cybersecurity. So generally, I recommend a very formal and insistent approach to cybersecurity as a must-have. And in terms of outside threats, I mean, we are constantly on the lookout for intrusion. Really try to lock down our attack surface through various means. One of the key things we did, though, back to the budgetary constraints, is that we realized we didn't have the resources nor the ability to insource our SOC center, or our SOC, and we really decided that for us as a small rural hospital, it was best to subscribe to a broker and essentially an MDR vendor. So that has reduced the cost for us significantly. It's still not cheap, right? But at the same time, there wasn't any way for us to build a SOC here on site due to our resource constraints, certainly. Also, there is a certain a lot of rural areas deal with this. There is a certain skill gap in our workforce. There wasn't really anybody here, in Bandon particularly, that was qualified to work in a SOC. So for us, it just really made a lot of sense to outsource that.
No, that makes a lot of sense. Yeah, I mean, costs are increasing not only for IT, but it seems that the compliance mandates are always changing.
Yep.
So, I'm curious to punch in a little further.
Sure.
On how you guys kind of handle the ever evolving like HIPAA policy updates. So like there's proposed updates for sometime this year. They did some temporary changes in 2020.
Yep.
And then, they had the phase 2 HIPAA audits in 2016. Obviously they're trying to modernize, regulations. And so I'm curious if you could punch in a little further, talk about how you guys address those regulation changes, how you stay on top of cybersecurity. And again, it seems like you're making every dollar effectively act like $20 or $30, which is crazy to consider. So yeah, if you could touch on that.
Yeah, I'd be happy to. So in terms of compliance, we're certainly compliant with HIPAA law. However, I'm not alone in this, and I think a lot of other CIOs and IT professionals are on board with the idea that HIPAA, it's a very nice entry point to compliance. But it in no way is updated for the current threat environment. I mean, it really is not. And so we do it because we're required to. We do find value in the HIPAA risk assessment. In terms of keeping up with, I should say before that, but in order to amend that, the HIPAA risk assessment, we also we work with our MDR vendor to keep track of our threat surface, our attack surface. We have regular meetings with them to kind of review our environment. We do penetration testing through them. We've also worked with Mimecast, our email protection vendor, to do a security awareness program. It's a really robust security awareness program focused on the end user. And one of the reasons that we do that is because end users are often the kind of the weakest link in the chain, and so we do a lot of education throughout the year, specifically focused on our end users. And we do things like we do social engineering tests, like sending an ad or something, to someone saying, hey, if you click on this link, then, right, the if then links. And so we do a lot of that, a lot more than is required. So we've really taken the tack that the current requirement for HIPAA is not sufficient for us any longer. We need to do more, and that will position us, for immediate compliance, hopefully, with improved compliance laws. And I can't really comment on the HIPAA proposal. I've read the proposed changes. I think that the most general comment I will make is that it is in the right direction, because, as I said, the HIPAA compliance laws are just not sufficient for the current threat environment.
Yeah. A lot of the new proposed stuff, again, is talking about kind of expanding patients' rights and how they can access their health data a little bit more efficiently.
Yep.
Tightening some of those time frames that are required for record deliveries.
Yep.
And then just transparency around fees and copies of health records. And then, talking about addressing some of the cybersecurity expectations around like encryption or like MFAs or like the utilization of cloud storage, which, none of those things really existed in 1996 when this thing rolled out. And so, and then now, I mean, if you look at 2020, how, a lot of the telehealth or the conferencing platforms, Zoom, Teams, things like that, they weren't particularly compliant with HIPAA. And then, so you started to saw a push in 2020 for that because telehealth was on the rise.
Yes.
So again, I mean, it's evolving and it's going in a good direction. And yeah, I mean, a lot of, people that we've talked to, when you said that your budget, like like almost like 10x your budget, I was like, geez, that's kind of crazy because, most of the time people don't understand the importance of investing in cybersecurity until, something happens, like in your case.
Yes.
It's always, oh, cool. Like it's never going to happen to us until it does. A lot of people and a lot of not only businesses, but even like hospital networks take that same approach, which is scary, which is really scary.
Yeah, I'll just make a couple comments on that, Blake, because you bring up a couple of good points. One is that what really drove us to particularly MFA, but also some of the other cybersecurity improvements was our insurance, and frankly, is they started requiring MFA. I think maybe 2 or 3 years ago. Maybe it was optional 3 years ago, but 2 years ago they did start requiring it to get a lower rate. So we'd already done that. We'd already implemented MFA, so we were there. But when it was not required, we took note of that, and then that really accelerated our adoption and deployment of the MFA program particularly. So there are multiple inputs here and multiple triggers that are motivating organizations like ours to improve our defenses. So I just want to make note of that.
Yeah. No, I'm curious to talk a little bit too on how you've invested in technology, especially cybersecurity technology. I know you said that your security operations center is outsourced, which is, a huge kind of like fee because the technology, just investing in hardware and then managing it and then making sure the drives are, it's just all the fun stuff, right? That you would expect with managing on-prem hardware. But how has Southern Coos invested in, beyond the SOC, like how have you guys invested in and security.
Yeah, we also invested in a zero trust vendor and Cloudflare, and they've been a great partner for us. We have a number of remote workers, so that was, something we really wanted to lock down during COVID. And then we actually had a different vendor, and then we've recently switched to Cloudflare, which we think is a superior vendor and product.
Yeah.
So that's a main one. Another investment has actually been in, and this is peripheral, kind of peripheral, but investing in our help desk solution. We're just in the midst of transitioning from a kind of a free model that didn't have a lot of functionality to a paid model that gives us a lot more functionality, so we can triage things very quickly and easily. And again, I guess I'll highlight again that security awareness training. I can't stress the importance of that.
So
it
important.
is very important for us. Because for the obvious reasons, but also because people forget, right? I mean, we're asking people to do their daily job, areas that they are experts in, and then we add on this thing that that they feel, in certain regard, they feel like it's kind of it's not really necessary, and or they feel like it's like, they feel kind of burdened by it, and they are. But it is an essential burden, in my view, that they take part in the security awareness training.
Yeah. No, I mean, it's so important. I mean, it's it's so affordable too.
Yeah.
Like, I don't.
And one more thing is we just recently revamped our asset management tool and our approach, where we are, keeping much better track of every single piece of hardware that we have in our ecosystem. Again, driven largely because of because remote workers, and then also, we were doing it, pretty well, but now we can really dive into every single piece.
I mean, asset management is so huge.
Yeah.
Asset management, security awareness training.
Yep.
Definitely go a long way.
Yeah, definitely.
Sorry, go ahead.
No, I said, yeah, I was agreeing with you. Mm-hmm.
I'm curious too, because being in a rural situation, and you guys probably face. I mean, I'm sure you guys have obviously faced some crazy emergent situations, like patients that have came into the ER, and you guys have had to work with other hospital networks. Like, explain how that particularly is handled from Southern Coos, transferring, data and information, patient records to other network hospitals outside the network or other health systems.
Sure. Yeah.
But how have you guys managed to efficiently do some things like that?
Yeah, that's a great question. So I'll frame this from a functional standpoint, and we, as a critical access hospital, that is one of the requirements, or I guess the description of the critical access hospital is that we're basically a hub and transfer model, where we bring in patients, we'll see them in the ED, and then we'll transfer to a higher level of care, if needed, if warranted, from a diagnostic standpoint. So, and in fact, we often have we often will instruct our, being mindful of federal EMTALA law, we will often work with our with first responders to divert patients to a higher level of care if needed. So, for example, if it's like an MBA, and we just don't have the capacity nor the equipment to triage even motor vehicle accident, they will often go to a higher level of care facility. So that is our model. For those patients that do come here, and we treat, stabilize, and then transfer, from a medical record standpoint, converting to Epic has been a game changer for us. Epic has you'll have to check this on me, but I believe that it's about a 75% market share in Oregon. It's very high, and on the West Coast is Veraha as well. So when we have patients transferred even to Eugene, Oregon, which is about 2 hours north, or less commonly we transfer them to Roseburg, which is about 2 hours east. We often have air flights to Portland for like neurological issues like stroke or aneurysms. Um, the ability for us to immediately transfer records on that patient has been a game changer for us now that we're on Epic. A lot of those medical facilities are in Epic, so we can essentially transfer medical records with the click of a button. Whereas with our former system, because it was not Epic, it would typically take 30 minutes, an hour, if not more, depending on the patient, the extent to their medical records. So it's just been, from an interoperability standpoint, it has just increased our effectiveness, increased our speed, and also increased our patient and family satisfaction scores, because we are able to say yes to the family. Like when they ask for medical records to be transferred, we can say yes, they are there, and get confirmation from the responding facility. So that to us has been the biggest change, and has really, really increased our kind of the trust in the system.
No, Epic has some great products. Actually, ironically, recently my doctors switched over to Epic,
Oh, that's funny.
and
Yeah.
and just the power of like my chart, like
It's incredible.
having your records, like literally. I know you talked about having an older demographic there, but particularly I've noticed just how much data I have in my fingertips, and I can monitor like literally blood test over blood test, and
Yeah,
see the progression of how like my health has changed. And I mean, booking at a fingertip is incredible.
it really is.
And I'm glad you guys have switched into that. It seems like it'll make things a lot easier, and it's a great product.
Yep, definitely.
You talked a little bit about security awareness training, but I'm curious if you could lean into a little bit further how you foster a cybersecurity first mindset around like doctors and the administrative teams. How can you pass besides cybersecurity, the security awareness training, how can you kind of foster and to have that think first, click second approach?
Right, that's good. So I think for us, it's an ongoing project. I'll just say that.
Yeah, yeah.
But our providers have they've adopted a lot of our cybersecurity projects, programs, our initiatives, and that has gotten easier over time. Again, when it hits, when it affects us, it is more tangible. It's something that our providers we can point to for our providers and say, look, this happened to us. It's not just a myth that people are getting attacked all the time. We can show them data, which I've started showing data for our the sort of general cyber attack frequency, and healthcare is like increasing year on year. It's increased, like exponentially. So I can show that data. Also, as our providers, as we are hiring providers, they are tending younger, and it they have first of all, they have experience with Epic, right? So they were often trained on Epic or Cerner, most often Epic, and they have used Epic. They understand the clinical workflows, but then also from a cyber standpoint, they either have been subject to a identity attack, or they know of a facility. Maybe they worked at a facility that had a cyber attack. It's so common now. It's actually really uncommon for people not to have personal experience with a cyber attack. That more and more people are, more and more of our providers are compliant and eagerly compliant.
That makes sense. I'm super curious from your role, your seat, how do you measure success with your IT initiatives and compliance? And is there any particularly metrics that you feel within your organization that you try to strive for?
Well, absolutely. It's a good question because, uh, a lot of times, we say, we're kind of pounding the drum in cybersecurity and people are like, oh yeah, eye roll. But I mean, I think that, so what we do is, so I, mentioned the security awareness.
Yep.
We have statistics about, by department, what the percentage compliance. So, we make that transparent. We make that data transparent. We also, in terms of the penetration testing and social engineering tests that we do, we have statistics about who clicked on what, and that we can go back and kind of work with the user who clicked to further education. So we have clear statistics around that. So that's from a education standpoint, those are my success metrics. Is that the higher we get in terms of compliance, and the lower we get in terms of clicking on phishing emails, the better. I will give you a quick anecdote. The first time we did the penetration testing exercise, not the penetration, I'm sorry, the phishing email exercise, I had a bet with our CEO. I said, "Oh, I'll bet that 50% of recipients will click on this link." And he said, "No, I think it's gonna be lower than that." He said he thought it would be around 20, like 15 to 20%. I was like, "You're on." So we had a bet. And in fact, it came in at 12%. So,
Like,
all that education is, that is a clear indication that education is working.
yeah, totally.
Yeah.
I'm
One other success metric on the kind of the back end
Yep.
is the our vulnerability scans, and we patch everything, or nearly everything, and so the number of patches per month, that's a success metric for us. We don't leave we don't leave anything outstanding. Um, and then we make decisions about, I should say, we don't leave any of the high criticality vulnerability scans. We don't leave those hanging. We patch those immediately. There's thousands and thousands of kind of lower priority that we don't necessarily patch. But those high criticality vulnerabilities we do scan, and we do patch immediately.
I'm curious, looking forward into the future of particularly rural healthcare. Is there any cybersecurity or IT innovations that you feel are most exciting about being implemented within your hospital network, or maybe things that you're excited for that you've learned about recently that you hope to kind of bring into the rural healthcare system?
Well, it's going to sound super dry, but I'm going to
That's
say
all
it
right.
anyway. The thing that I'm most excited about, I think, I don't know if it's what I'm most excited about. I'm really excited about right now, which is automatic log review. And we have a real problem. We just don't have capacity to review logs.
Yeah.
And so there are several products on the market for this. But we have not invested in that yet. However, it's on our roadmap, and I think even though we have a pretty good IS department for the size that we are, I think that we can automate that log review quite easily, either by securing a third party vendor or even building an AI agent internally. So.
Yeah, no, I mean that all great answers. Um, and I know this is like kind of like a wish list thing here, but you're particularly on the front lines in smaller communities and serving, patients, from a cybersecurity perspective. Um, what would make your job easier from a federal perspective, from a compliance perspective, like
Mhm.
is there things out there that, I mean, obviously we all have challenges within our careers, but is there things that you feel like are super inefficient?
Mhm.
Um,
Mhm.
and then, how are you kind of combating those, or things that maybe you wish for in the future that would be a little bit more streamlined in a rural environment?
Yeah, that's a really good question. Let's see. I mean, just going back to the regulatory, issues, if we could have a single source of truth for all regulatory issues, including or regulatory requirements, including HIPAA, including cybersecurity, including state regs, including CMS regulations. If there was a single source of truth and a clear roadmap to fulfilling those regulatory requirements, that would make our jobs easier. Every organization kind of has to piecemeal it together. There is state support. In Oregon, we have, our Office of Rural Health is really active in kind of helping create that roadmap and that single source of truth. But even they are, um, it is very difficult to keep up. So if, what I would suggest is that there would be a single set of guidelines that are clear, that each element is clear and distinct without any overlap, because there's lots of overlap in the regulatory requirements, and I think that that would help us. Uh, that would really help us from an efficiency standpoint. Um, I think also, um, I'm kind of pivoting a little bit. I think, and I've suggested this at the state level, but it hasn't really gotten anywhere yet. I'm hoping that it might at some point in the future, but some sort of, you know, statewide or multi-state collaboration around cybersecurity, kind of setting, like cybersecurity office from, state to state. And
Like kind of like CISA, but for health, right?
like CISA, except for health, and also,
Got it.
maybe that's state by state, maybe it is federal, right?
Yeah.
Yeah,
Yeah. Yeah.
because CISA is, and also I'm worried, right? Like right now, I think CISA is under fire a little bit. I think,
They are.
if the states were able to, kind of create something similar that had a clear line to federal requirements, right? Um, that would be very helpful.
I'm curious, something like that really exists, like
No, I just dreamt that up one day.
oh, I mean, it seems like it'd be efficient. Like, let's just say, for example,
Yeah,
there was a hospital breach that happened in some part of
exactly.
Texas or something, right? And this is like,
Yeah,
look, here's how it happened. Here was what we noticed, and here's how we fixed it. Some
right.
type of kind of like whiteboard that other hospitals could read that says like, oh, cool, like, or not
Yeah.
cool, but oh shit, a
Yeah,
hospital
yeah,
in
yeah,
Texas
right. Yeah.
was hit. Like here's how
Yeah.
here's what we need to look out for, right? So kind of like a memo board for health cyber attacks, right?
Yeah.
It seems like something like that should exist, so that way, these smaller hospitals can mitigate risk and
100%.
be more
Yeah.
efficient.
Yeah, that's I've had that idea in my mind, in the back of my mind for a long time, just, to because there are lots of uh I guess message boards or, you know, tools out there for other kinds of cybersecurity related issues. I mean, like there are a million hacking sites, right, and hacking message boards and things like
Yeah,
that. And
yeah,
so, but I love that idea of just having kind of a centralized repository or communication platform in which people are sharing the unfortunate attacks, but then also sharing how they mitigated the impact, tool tips, that kind of thing. So
needs to happen. Needs to
yeah,
happen.
love it.
Um, we are at the top of our hour here, and I feel like we covered a lot.
We did. Thank you. Appreciate it.
Yeah, your insight is amazing. Again, like I said, it is super unique to have a perspective like yours.
Thank
To
you.
gather information and to approach things a little differently. And hopefully, I mean, our listeners, I'm sure they'll find a ton of value and seeing things the way that you see things, especially coming from your background, having to make things work doubly, quadruply, efficient and growing from there. So, is
Great.
there anything you feel like we didn't talk about, or maybe that you had sitting in your back pocket that you were waiting to pull out?
Well, just one, and I'm not sure we have the time, but I'll just talk
Do
about a
it.
very high level, which is
Go ahead.
AI and innovation. And so I will just say that I have been part of an advisory council working with several folks to create a rural health community. The RHC is what we're calling it so far. We may rename it at some point in the future, but it's we're in the very early stages of developing this. And as part of that work, I have also been developing essentially an AI governance toolkit for rural health. And so I'm hoping that that will be done in about a month or so. And then it's somewhat self-serving because I need the AI governance here at Southern Coos because we're deploying several AI tools and initiatives over the next year and a half or so. We also have some AI projects already in existence. So I needed the governance, but also, because I believe in rural health and, again, a lot of people don't have the capacity to, develop it on their own. And why should they really? We're going to make that toolkit available to any rural hospital that wants to utilize it.
Yeah, I mean, and we would love to share that information with our listeners. Is
Perfect.
there any way that they could find or maybe get involved or participate in your new project?
Yes. I may need to get back with you on that, but it's
That's fine.
rural health community. I can get you the URL. It just recently changed. I think I'll need to get that URL to you.
Yeah, no problem. Thank you so much for spending, an hour with us and sharing and yeah, we'll definitely stay in touch. I look forward to getting those URLs and then not only that, but distributing those and helping kind of get the word out about, not only Southern Coos, but helping, more people that are in the regulated health space understand a little bit more about cybersecurity, how they should be effectively implementing strategies to secure their networks, their patients, and yeah, I think a lot of people can learn a lot from what you're doing there.
Great. Well, I really appreciate the opportunity to talk with you and hope that your listeners get value out of this.
Oh, they totally will. Totally will. Thank you so much for your time, Scott, as well.
Thank you, Blake. Talk to you soon.
All right. Yes, sir. Bye-bye.
Bye.
That's a wrap on this episode of Encrypted Ambition. Subscribe wherever you listen, and if today's guest inspired you, leave us a review or share the show with someone in your circle. To learn more about how we support innovators with AI, cybersecurity, and compliance, head to petronelatech.com. Thanks for listening, and remember, the future favors the bold.